Hello and welcome to Healthy Living. I'm your host Melissa Hodgson, and we're talking today about robotic surgery. We'll talk with 3 local surgeons who rely on the Robotics Institute at St. Tammany Parish Hospital for the technology that enables them to do minimally invasive surgery close to home. First, we'll visit with Sunil Purohit, local urologist. Sunil, thanks for joining us today.
Nice to be here, Melissa. Thank you.
I'm excited to be talking about this. Yeah. You were the early adopter that really tried to talk the hospital into getting into the business of robotics back in the 2000s.
Yeah, I remember those days. You know, the Vinci robot is very technical, very specifically designed, instrument. And it's a very costly affair. And so, of course, when you're talking to administration, when you're talking to, the board about, spending, upwards of $1.8 million on a, technology, it's not that easy. It's not that fun. But we had a lot of, just a lot of experience in observing all these cases that were done early on in urology. And when the robot first came out, the FDA approved the robot in 2000. And soon after, the major institutions throughout the country were really embracing it in the field of urology, prostatectomies and kidneys and things like that. And so, we had a good feeling that this is going to be the future. And we better embrace it, or if not, then we're just not going to have it in this area.
Right. Well, and so urology was that area of specialty that could see what robotics could bring to procedures. And you're right, obviously in 2000 when it was first approved through the FDA, it was mostly in teaching institutions and major institutions around the country. There were major institutions in Louisiana that had it, but only a few. And so when St. Tammany bought their first robot in 2007, that was the first one on the North Shore, it was the first one on the I-12 corridor.
That's right.
It was pretty exciting, but the hospital stayed engaged in that, and that had a lot to do with what you were doing in urology. You can talk specifically, I think, about prostatectomy, for example. Before the robot, that was something that could not be done minimally invasive.
No, and actually, just for example, the average blood loss for an open prostatectomy nationally was between 1 and 1.2 liters of blood. And now with the robot, you were talking about 100 cc's, 50 cc's. We don't even type and match our patients for blood anymore. So that has been taken care of as far as a major issue. And then, so what that entails, you have patients that could be a little bit sicker, a little bit older, and patients that you'd be worried about, recovering from an open prostatectomy. You can do the same procedure in a minimally invasive fashion, and they go home the next day. And so it's amazing.
Well, and you look at that as our history from 2007, and then moving forward, we're up to 3 robots there at St. Tammany Parish Hospital. And you and your colleagues have achieved quite a milestone in 2019. You crossed the 5,000th case.
It's amazing, yeah. And it's only getting bigger and bigger. As, like you said, we started with 1 robot, now we have 3. And so that means that you have 3 rooms that are going sometimes at the same time. And so as patients come in, as the robot continues to evolve, we're able to do more and more complex surgeries throughout the field. Now even cardiothoracic cases are being done robotically, specific cases like valves and things like that. There's a lot of options out there for surgeons. And so, the sky's the limit, I think.
Well, I think it's really exciting from the patient safety standpoint. Like you were saying, much less blood loss, a much shorter hospital stay, quicker recovery. And in urology, can you kind of outline some of the specific procedures that you as a urologist are able to do as a result of that robotic surgery?
So we talked about prostatectomy.
Sure.
And the 3 advantages for that procedure: less blood loss. You can actually do a nice, what we call nerve-sparing prostatectomy, where you can spare the nerves for erectile function. Incontinence is a big issue when you take a prostate out. Robotically, it's minimized, and usually within a few months, patients are pretty much back in control of their own urinary function. So with prostatectomy, we went to kidneys. Now, majority of the time before the robot, kidneys with cancers were being removed in total. If you had to do a open partial nephrectomy or open removal of a part of a kidney. That was a very morbid procedure. You know, patients were in the hospital for 4 or 5 days. Now we can do it where patients go home within 23 hours.
Wow.
And you know, you can basically take the tumor out, reconstruct the kidney all within 30 minutes. And generally, you know, what that has allowed is for patients, like I said before, who are in their 70s and 80s, who have tumors, you know, you can actually get them through a treatment in a very efficient fashion, where they're home, they're back to their loved ones, they're back on track with their normal activities fairly quickly. So that was another big one. Another one is pyeloplasty, where we take a stricture and a ureter, so we can cut that stricture out and we can hook everything back together, putting the ureter back together with sutures. And before, you'd have this big hockey stick flank incision. Now you can do it through 4 little tiny incisions. Wow. What does that entail? You know, the recovery is, again, very easy comparatively. Less incision, less chance of infection, less scarring, quicker recovery, and that's what it's all about. So those are the type of procedures that are, you know. Another one that I'm really excited about is vaginal prolapse surgery. Okay. So, you know, a lot of these problems come up when patients in their older years, and before an open prolapse surgery would be a fairly, you know, morbid procedure in a sense that it takes, you know, maybe 2-3 days of hospital recovery, etc. These patients sometimes can go home the same day even. And I'm talking, most of these patients are older, again, in their 80s, late 70s. And so, you know, it has really opened the treatment platform for, you know, patients in the community. And it can all be done in the North Shore. They don't have to go to Houston. They don't have to go to New York. They don't have to go to the South Shore.
Right.
It can be done in Covington, Louisiana.
Well, and we're excited to be the host facility. St. Tammany Parish Hospital's Robotics Institute, that began with the first purchase of the robot in 2007, has grown, and now there's this wide variety of surgeons and specialists who are able to use it. And it does mean that we're meeting that mission of providing that level of world-class health care close to home on the North Shore.
That's right.
Well, Sunil, before you go, can you think, in your specialty of urology, what's the future look like with robotic surgery? What's coming next?
You know, there's talk about eventually, you know, basically meshing the CT scan with the Da Vinci robot. Wow. On the same platform, where you can get an X-ray, a CAT scan, you can find a tumor, say in a kidney, and basically fill in the coordinates, and the robot could actually do the surgery, which is not good for, you know,
for surgeons.
But, you know,
you'll
it could
still
be more
have to be in control at the console.
Well, we'll have to at least put the instruments in the patient and close everything up afterwards. But things like that, there, you know, are things where we can actually hopefully be able to inject some medication into the patient intravenously, and that might help us identify the nerves for prostatectomies more easily. That's being done in the lab, and hopefully eventually it's going to come out, you know, in the real world. And small things like that can make huge differences in treatment. So it's amazing. I think has it been 13 years, close to?
Yeah, 13 years since we got into robotics.
Started talking about and got into robotics. Urology has changed tremendously, and it's all centers around the robot.
Well, it's exciting times. Thank you so much for coming in and talking with us today.
Absolutely. Thank you for having me.
Up next on Healthy Living and our special about robotic surgery, we'll be talking with Dr. Patricia Brawley about women's cancer and how robotics help her to do surgery.